Welcome to the Summit Podcast, the show where we dive deep into the behind the scenes with our Summit instructors, exploring the stories, insights, and breakthroughs that inspire us to elevate your practice and transform lives. Today, we're honored to be joined by Dr. Jeff Rogge, a leader in outpatient orthopedics, chronic pain management, and manual therapy at Mayo Clinic. With decades of experience, Dr. Rogge has not only shaped the lives of countless patients, but also mentored the next generation of physical therapists through his teaching and advocacy work. From groundbreaking research in dry needling to his unwavering passion for helping patients find hope in healing, Dr. Rogge's journey is nothing short of extraordinary. Whether you're a seasoned clinician, a student, or just someone who believes in the power of movement, this conversation will inspire you to see the human side of physical therapy in a whole new way. My name is Castelle, and let's get started.
My name is Jeffrey Rogge. I'd like to be called Jeff. I'm currently a staff physical therapist at Mayo Clinic in Scottsdale, Arizona, and I've been working with Summit for about 4 to 5 years now, teaching classes in person and virtual.
So let's touch on that in-person part for a second, because manual therapy is so personal. How do you balance the technical skills with the human connection required to truly make an impact?
So I think if you asked me this question like a decade ago, I would have been like, it's all about the manual skills in that aspect of it. And we got to spend a bunch of time learning a bunch of different techniques for the specific things. But now what the research is more so kind of showing us is that that is secondary to that patient therapist connection. The specificness of the technique is less important than it is to have the patient feel comfortable with you as a provider and building that therapeutic alliance. So as we've gone and in my courses, we teach like a few techniques that we can use in a lot of different ways to help just build that familiarity with the techniques. And then also with that, then you're building confidence in yourself, which builds confidence in that patient to trust in what you're doing. So as things have evolved and the science behind the therapeutic alliance being more and more important, the emphasis on what specific techniques you're using is less important. So I think now just finding techniques that you're comfortable with. And I think that's the perk of like some of these classes too, is if you're coming in with multiple techniques, I don't necessarily have to change those. Hopefully I can just add to your toolbox. It doesn't have to be exactly my way.
I love that. And I think what you touched on with the patient alliance is so important because chronic pain can feel so hopeless for so many patients. So can you tell us a story about a patient you worked with whose transformation really stuck with you, or what it was about that experience that changed how you see your work?
Yeah, I think that because sometimes the chronic pain patients are daunting for them. They're in a ton of pain. They feel hopeless. They feel like they've tried all these things and they're not getting anywhere. And then also it's kind of daunting for you. You see this person on your schedule, and if they're like hyper vigilant on the pain or that kind of, or you're just reliving the same session over and over forever, it just is extremely exhausting as a provider and the patient. So I think there's like a few examples that I've gone through where it's like that patient has really stuck with me. And I think it's just like, hey, we're in this together. We're going to pivot things the best way we can. And just having that initial, like, once again, the therapeutic alliance to know, hey, no matter what, we're going to get through this together. Because often they'll come to you expecting something different than they've seen before. And then once that, you do that, whatever different technique 4 or 5 times, then they're right back to where they started. So it's just having that connection of, hey, we're going to change things. We know over time your pain is going to go down and your function is going to go up. It might be a bumpy road in how we get there, but just like knowing that we're going to do this together. And if that includes manual therapy or therapeutic exercise, or, just basically finishing the drill, being what that patient needs each time, has really like, that's where I think I've evolved over the last like 10 years. Before I would have been like, I have this plan, we're going to stick to this plan. That's what's going to make you better. And I probably had greater patient drop off versus now where I'm just like, hey, I'm your guy. Let's do this together. It might take forever and it might be exhausting. And sometimes we have to give ourselves a pep talk before each session, sort of thing, to just like get through it with the end goal of hopefully you don't need me anymore.
Yeah, I love that, because I know that something like chronic pain too can be frustrating for clinicians too, as progress can slow or feel uncertain. So what mindset shift do you think physical therapists need to stay motivated when treating these patients?
So I think the way that we've been going about it is I've been seeing the patients like one time a week, and I just kind of think about it as like, I'm your physical therapist versus like you're coming to me for physical therapy. So the same idea as when you go to other professions, you don't go get dentistry, right? You go see the dentist. So you're coming to me for my professional opinion. Then it's less that it's putting them more in control of it, that you have to go home and you have to do the things we're asking you to do, and you are in charge of you getting better. And I'm just there to provide that therapeutic nudge. And I think then you're seeing them on a lower trajectory, longer horizon versus the 3 times a week. You're seeing them with every ebb and flow, every good day, every bad day. And it's just too much of a yo-yo type of act where you're just kind of banging your head against the wall on the bad days and you're over celebrating the good days. And it's just like, it just needs to be slow and steady type of approach. And then also when I'm your physical therapist, if you feel good and we end this episode and in 2 or 3 months you need me for something related or unrelated, then you can come back to me. So that's kind of more the approach I've been versus like, I'm going to see you 2 to 3 times a week for 12 weeks. And this is going to be my plan. It's just like, I'm going to be here with you to finish this drill and like get through this, even though it's frustrating for you and me.
It just sounds so human like that. I, even if I was your patient, I think I would really resonate with that approach though. Like being like, I'm your guy kind of a thing to help put people at ease, you know?
Yeah. And I think that like back in the day, and there is like certain like physical therapy education out there where the patient and therapists don't necessarily need to talk, right? And I think like 10 years ago, I'd have been like, I'm going to get you better despite your input, despite your lack of like helping me here. And that just, the research is just showing that that's not the case. Like having that connection is probably more important than any specific treatment that I'm going to do. And that's something that I really evolved and with over the 10 years, the last 10 years probably, and hopefully like patients are getting better because of it.
Yeah. So can you expand on maybe some more like actionable tips to help build that alliance? Like what's an example of something that you do?
When it comes to therapeutic alliance, the highest amount of therapeutic alliance is at the 4th visit and then on. And then the highest patient drop off is at the 3rd visit. So it's one of those things, it takes a few times to build that connection. So if you just come in hot, you're like, first visit, let me tell you, you're thinking about everything wrong. We got to change this paradigm. They're probably going to fall off, right? So it's just building that connection at the patient's speed. Sometimes it happens early. Sometimes they come in and they're like, hey, I'm ready. Let's talk about these things, or let's make a plan now. And then sometimes it's a slower burn, right? Like I'm coming in to fail therapy so I can have surgery. And so that person's going to take more work to get built in on, this is what we're doing is going to help you. And we talk about this in some of my classes, but there's multiple techniques. One is just being a person with them, remembering things about them. Like I write down notes, like the patient likes to do XYZ. Their dog's name is this. They're doing this weekend. And it just helps you to remember the conversations you're having and like making that connection on a personal note. And when it comes to building relationships, the initial 10th of a second, people make opinions and then it gets harsher from there. So that first impression is really important. And just like letting them talk, letting them vent, letting them know that you're like have seen stuff like this before and that they matter to you particularly, and then just building a relationship on being able to talk to them about their symptoms, what they're going through, having empathy with them, and then just making a plan. And then just being like, then when you get further along into that plan, you can be like, hey, we don't really care about that pain anymore, or we're like really proud of these little slunkable goals. So ultimately, like if I, like when we have students, my first, like those first few times are, I just want you to talk to these people and get to know them and build some sort of connection. And we do that in my classes. Like we make everybody do an introduction, and I tell you my stuff. I tell you I went to University of Montana, you know, things about me, like my wife, kids, names, our dog's name. And then you think it's like, once again, the research shown, you think you know a little bit more about me, you start to trust me, and now we are more connected in this class even, versus me just cold starting, getting up there, throwing information out about you, or to you, you're not going to feel as connected to me. So that's where you just got to make it a little bit more personable.
I love that, especially too, because I feel like it helps people actually absorb what you're saying when they have somewhat of a vested interest in who you are.
Yes. And I think one thing we get stuck in, especially early in our PT career, is like the goals. We have to meet this goal, and they're these huge goals. Like, I want your pain to go from 10 to 1, and I want you to go from like, I can't walk to now I'm running type of thing. And in the chronic pain population, the goals might be a whole lot less of a jump. It might seem more minute, but to that patient, that's a big deal. Like, I went from waking up 10 times in the night because of my pain to waking up 4 times. And it just seems like less of a thing. But early on in your career, you just so like gung ho to make huge changes. And with these people, you just like, you know, eat an elephant one bite at a time. And then in hopefully a year, you look back and you have made those huge goals. It just is a different growth curve than with a typical like orthopedic patient.
I also think it's really inspiring to hear the growth and the depth that you've developed just over the course of your career, and kind of seeing how that impacts the real life situations of your patients. So just to touch on the power of mentorship here, because I know you've mentored so many clinicians and students. Can you share a moment where you saw someone you taught succeed and kind of like how that made you feel?
Yeah, I think like the mentorship thing is been super huge with me. I think it's easy to get burnt out. It's easy to feel like you're all alone, or you're just the unusual person in the clinic that's like reading these things or doing these things. It just is like, it's easy in this profession to feel like kind of lost. So early on, I reached out and got some mentors, and people were super excited about that. And then like excited to mentor me, right? Like it rejuvenates them also. And then as I've started to mentor people too, the nice thing is it keeps me on my game. I start to learn stuff. I have to keep up on literature and things like that that's going on, and trends. And then I learn a bunch from them. I think in our profession, we're all usually super humble. So it's hard for any of us to ever think like we know enough to like teach other people. So it's like, it's hard to have that confidence, but having some students or like fellows in training or orthopedic residents that have gone on to like publish a bunch of studies or teach in their own classes or working in academia or running amazing practices, or we have orthopedic residents that are now highly involved in the APTA. I think that's just so cool that I have those connections. They are no longer my mentee. It's just we're friends, and to see them succeed and ultimately push the profession forward, because I don't ever want it to be like, if I'm not in charge, you're missing out on the point of the sword, right? Like, we just want to make the whole pie bigger. And so everybody grows and everybody gets better treatment and everybody gets better work environments and those kind of things. So just growing the profession in any way that I can help with, along with then watching my friends succeed, is super awesome.
Yeah. So now, like, let's say I'm maybe one of the students in your summit course and I'm interested in being mentored by you, but maybe I'm a little bit shy. How can I go about doing that? How can I go about taking that next step?
So I give everybody my email address. So like, let's think about it, and you can always reach out to me there. And then like when it comes to like in clinic hours, that gets more difficult, but like in an asynchronous type of relationship where it's just like, hey, you want to talk to me? I have these questions, XYZ. We can do that over email or, text or phone calls or FaceTimes. Because this is something that I like to do, right? Like I want to help teach these classes. I want to help people feel confident. I want to give people a sounding board, or I want them to listen to me when I have questions and that kind of stuff too. So just like that open dialogue, I try to make time for everybody who reaches out. I don't think anything needs to be monetary with it. I know that there are some programs out there where you have to pay for mentorship, and I understand those. I just don't think that I want to do it that way. I just want to kind of be your friend, and then hopefully we'll bump into each other in continuing education and help each other grow in that manner.
I love that. I wanted to circle back to something that you had mentioned earlier, but there are so many paths in physical therapy: manual therapy, research, teaching, advocacy. What advice do you have for PTs who are currently feeling a little lost or unsure of their next step in the profession?
Okay, that's a great question. So when I was early in my career, I worked in private practice, outpatient, quickly started managing a clinic like so many people do, and went into leadership in that company quickly. And then we moved here and to Arizona, and all of a sudden that started to be like, I don't know if I can necessarily recreate this path, right? So maybe I'm not in leadership now. And then I had to decide what avenue I wanted to go down. And so ultimately, I worked backwards from like, I think I want to teach classes. And then what do I want those classes to be in? And then what do I need to do to get to where I feel like I'm an expert in the field to teach those classes? So I think, and we see that a lot of times with students, right? Like, I don't know if I want to go even in a more broad, I don't know if I want to go into acute setting or like a neuro rehab setting or outpatient setting. And then like if you choose outpatient, you don't know if you want to go into neuro or orthopedics or women's health or, like whatever specialty. I think ultimately is just reaching out to people and just like asking lots of questions, making those connections with people. The amount of people who I have asked for help along the way who have been more than willing to help me it's just been overwhelming. Like initially I'm like, I don't know, this person's kind of a big deal. And everybody's been so helpful. So, and one of my things was like, when we moved here and I started over, I was like, I just don't want to be climbing a ladder that's on the wrong building, right? So you have to just find what makes you happy. The nice thing here is you can switch and like you can have multiple careers within a career. And then what we talk about a lot of times in my courses is because people maybe eventually want to get to where they're treating outpatient or they were doing more manual therapy, but they're currently in a different setting because there's bills to pay and there's a job to find in life, right? Or like I need to work around my schedule, my kids, and home health is the best option. That just means you're in the right place, right? You're still learning stuff to help you get to where you want to go. And like I did that when we moved here. I worked in a setting that had nothing to do with outpatient manual physical therapy until I could find the right job, right? So life just happens and you're in the right place and you can get there. You just got to figure out where you want to go and then reach out to people to help you climb that right ladder. And then it's okay if it takes a long time or it's okay if it happens right away. It's a tricky question because like obviously I'm biased towards outpatient manual physical therapy. But I also will have students that come through that want to go do neuro. So I do my best to get them in with my friends who are neurospecialists and help guide their career that way.
I think you personally have accomplished so much in your career. It's very easy to kind of feel like that, wow, he's larger than life sort of a vibe, but you're so relatable. And I know that that's something that people struggle with in this profession as well, is that there can be some kind of strong, intense, big personalities. And so many of us are getting advice like build your own brand. And so what's maybe some advice that you would give to someone who is trying to kind of establish themselves or maybe even reestablish themselves here?
So you're super spot on, right? With everybody that's out there, the big personalities, in whichever type of avenue. And so when I started to be getting into like teaching the con ed, I spent a bunch of time being like, because there's a whole lot of people out there that professionalism is less of an issue and you're trying to just be the game changer type person. And they're like cussing and dressing less professional and really pushing hard this different agenda than stuffy old PT school. And then on the other side of that, it's like stuffy old PT school jacket, very professional. And ultimately, I just decided I'm just going to be me. And so I'm going to have fun. We're going to hopefully learn stuff. We're going to celebrate little wins. And we're going to like do high fives and tell dumb jokes and just be proud of one another. And I think because that's exactly what I found when I got my fellowship and I started to go follow other fellows. It's like, this person is super intense. This person is super lax. And it's just like, just finding your avenue, who you want to be, and just knowing that a lot of those other things are going to probably come and go, right? Like the being brash or the being super condescending, super one-sided in the beliefs that we believe in versus just letting evidence-based practice dictate where you want to go and then just finding your own path.
I did want to ask, so you mentioned clothes. And I don't necessarily think that people are getting into physical therapy expecting it to be some sort of a fashion show, but they do matter. And so can you give us a little bit of insight on how you approach dressing for the job and why you do so?
When I started being a PT, I initially got a master's degree. I'm old, right? So it was not uncommon to go. So I grew up in Montana. It was not uncommon to go see a physical therapist in Montana that looked pretty rough, right? Like t-shirt, unkempt beard, that, the Merrill shoes that my dad's still wearing type thing. And which I'm sure those PTs were providing excellent care. But what the research has shown is the patients expect you to present yourself like a doctor, right? So that's not me standing on any type of soapbox. There's actual research out there. So, and ultimately it makes your job easier. So my job, I work at the #1 hospital in the world. That automatically makes patients think that I know what I'm talking about. And then when they come in and I have a shirt and tie on and I present as Dr. Rogi, and then I quickly introduce myself as Jeff, I have now won them over in that first, 1/10 of a second that they think the person that they're seeing knows exactly what they're talking about. And this is who they should be seeing. So it ultimately makes my job easier to wear a shirt and tie when it comes to therapeutic alliance. Sometimes when I'm trying to demonstrate exercise, I can't lift my arms the way that I want to because of my shirt. So that is more of a liability. But presenting yourself in a way to the patient that you are an expert in the field and it's what they expect. Patients expect at least a little bit of manual therapy. They expect you to be professional and well kept and clean and hygienic. And then that ultimately makes your job easier. So that's why I dress the way that I do. So shirt and tie every day. This is one of those things like, 15 years ago, I definitely did. I wore the standard PT uniform of khaki pants, tennis shoes, and a polo, right? So I've definitely changed this over the last few years, and it's ultimately helped my patient outcomes.
I believe it. I also, the blue is very calming. It's a very nice, like you feel reassured.
Thank you. My mom thinks that I need to have more colors than blue, but she has to talk to my wife because she buys all my clothes.
I personally actually almost always wear either white or pale blue because they've done a lot of studies where they show that those are the most trustworthy colors. And so when you're in a situation where you're rapidly trying to build trust, those visual cues make a big difference versus wearing something like a black or like a red that can be kind of perceived subconsciously as maybe a little bit more intimidating and people feel a little bit more guarded. So I'm a big fan of the blue.
Yeah, and that the same type of idea goes with like the chronic pain patients, right? So if you come to a standard, more sports oriented clinic where it's like louder music, there's young athletic people, there's people like bouncing around, jumping, running, those chronic pain people feel like they're in the wrong place, right? And then vice versa goes if you come to a more clinic like our clinic here that's set up for more chronic pain where it's like calmer, the gym is less exciting, the music is less exciting, and it's then the athletic person feels out of place too. So it's like that comes with all of it, just trying to build that clinic to look like what you're trying to treat and build that atmosphere, and comes with the dress, comes with the colors and all those things.
I also think that, so physical therapy is such a demanding yet rewarding field, but I love that we've talked so much about transformation and change and things you've picked up along your path and things you've maybe put down. So can you give us some insight onto why you chose physical therapy in the first place and why you continue to choose physical therapy? Because I'm not sure if those will be the same answers.
Yeah. So when I chose physical therapy, I kind of dumb lucked into it. So I was going to college and I didn't really have a direction, and I was kind of playing football, and then I just sort of, and I felt like that's why I was there. And then when it came to like trying to choose a profession, I just had no idea what I was supposed to do. And so I remember the exact conversation. I was thinking about leaving school, and my mom sat me down and we talked, and in her small town, there was a physical therapist that she knew and like was like, seems like this guy's got a nice life. Right. And so I then like talked to him and was like, oh, I can still be active. I'm not just sitting at a computer all the time. I can continue to push myself academically and try to, and ultimately just kind of like, I felt like I was sort of scratching the surface of who I was going to become. And then learning more about the profession, it felt like there was lots of opportunity for me to continue to grow. And so I think like when people ask me why I got into physical therapy, I think it was just dumb luck. I think a bunch of people helped me solve my problems in life, and like I am eternally grateful. And then like why I continue to do therapy, why I continue to practice in the clinic, I think is because our profession is going such a neat direction, right? Coming from back when I started, and it was like you would get these scripts and it would be like, this is exactly what you need to do with the patient. And it was more dictated to you. And now we're becoming more like the primary care provider of musculoskeletal injuries. I think, and just like actually acknowledging our degree, our knowledge base, our ability to improve patients' lives and ultimately, hopefully, society, right? So I think like it's just such a neat profession that probably is going to be just getting started with how great it is by the time I retire, right? But I think it's just going such a cool way. And I think in this world of over medicalization, in this world of quick fixes, it's our profession is this like guiding beam on there's another way to do things in life and medicine to get better in the musculoskeletal realm. And I'm really excited to see where, like these younger providers push this profession.
No, I love that. And if you could leave just one lesson or say a message for every PT listening to this podcast right now, something they could carry with them in their own practice, what would it be?
Okay, the thing that I think about often, especially like residents, students, that kind of thing, everybody is in a hurry to show everybody what they know, right? So it's like, oh, it's this. But sometimes we just got to slow down and rule out all the things we don't know. And I think that comes with like decision making and like where I want to go in my career, like asking myself, what would make this fail? What would make this not go the way that I want it to go? And just make sure you're asking yourself those questions. I think when it comes to evaluating a patient, to make sure you rule out other things and proving your initial diagnosis correct versus just jumping on that and then hoping that the other things get ruled out. And I think just like taking a little bit more thought into like just ruling out all the things you don't know when it comes to like social media. People are so quick to get on the anecdotal, that type of stuff, like, hey, this is how I treat now. Or it'll be even like I go to a class and you come to my class and I teach you 4 techniques that you take back Monday. And then people will be in a hurry to be like, well, everything I did before that was wrong. And it's just not necessarily the case, right? So just being a little bit more thoughtful of like ruling out things, making sure we're on the right path.
I think really just what I take away from speaking with you that is really impressive is the commitment to flexibility, but also all the intentionality behind everything you do. So it's so easy for maybe someone to think like, oh, this guy, is just making small talk. And there's a whole reason behind it. There's a whole huge host of reasons behind it. So I think that's really inspiring for people to be able to take away.
Yeah. And I really feel like the intentionality is part of what I have evolved in, like too, like before, like when I was early, I just like, it was like, I'm awesome. Everybody needs to know I'm awesome. People should know I'm awesome. And then it's like, Mozart became Mozart by working hard and like spending hours and hours and hours learning to play the piano, right? It's not necessarily, it was this gift that he was given. So I think deliberate practice in whatever craft you have, right? And with this, it comes into the teaching too. Like I taught 2 classes for free, just being like, hey, I just want experience before I ever started. And then just trying to be a little bit more intentional on making sure I was going the right direction that I wanted to go. And it hasn't been smooth and easy, right? Even though sometimes it looks smooth and easy.
Well, because everyone's sharing their highlight reels, right? So what you're normally seeing is what people choose to broadcast about themselves. And it's pretty rare that people are like, hey, I'm struggling. Hey, this is hard. Hey, I got into this and I'm not sure if it's what I thought it would be, So I really appreciate that transparency because I hope it helps someone listening to it.
Absolutely. Even this podcast, right? So we have this role. My wife's job is very busy and I take our kids to and from things and I do a lot of stuff at home. And like my wife had to change her morning to take our kids to the bus stop because that is normally my role. And you're like, it's not, so that's why it's like, it's okay if you're not where you need to be yet, because it's just not that easy. As much as if I could get on Instagram and put this to some music and make it look cool, like it's easy. But then you see that, like when I was doing fellowship, I remember we were in one of our weekend intensives and I was sitting there with my phone and I was just getting blown up from home. Kids were mad, wife was mad, people are mad that I'm not there. And I remember just like feeling like overwhelming. And then there was a guy at a different table who then said, oh my God, my wife is so mad at me right now. And then there was like a lady who was like, my kids are just hitting me up that they're so mad that I'm not home. And it just kind of spread into this, like, everybody here is struggling. Everybody is giving up something to be here and try to get better. And so you're just not alone in these tough times, right? But we could have all easily sat there and just pretended like things were fine, but you're probably not alone when it's hard.
I love that. I think that's so important too, because especially so many of us are kind of like trained to hide any weakness, but the weakness is really what kind of bonds you together in your shared humanity of we're all going through this. A huge thank you to our listeners and Dr. Jeff Rogge for sharing his time and his expertise with us today. His stories remind us that behind every technique, every treatment plan is the potential to profoundly change a life. And that's why we do what we do. If you found this conversation meaningful, be sure to share it with your colleagues and friends in the PT community. And if you're inspired to take the next step in your career or learn more about the topics we discussed today, you can visit Summit's website for resources and Jeff's upcoming courses to help you grow. Until next time, I'm Castelle Winter. Keep moving, keep growing, and remember, the work you do every day matters more than you know. See you soon. Bye.